Hello and welcome to my presentation for Meniere's disease. My name is Laura Ross and this is for human disease and pathophysiology. I'll be describing Meniere's disease and talking about some of the causes and symptoms, treatment, and complementary therapies that you might find for this disease. Meniere's disease is a rare inner ear disorder that is characterized by episodic vertigo, fluctuating sensory neural hearing loss, tinnitus, and oral pressure. It was named after the French physician Prosper Meniere, who first reported it in 1861. Other patient complaints include nausea, which can be super severe or very, very mild, but some have had it where it is almost debilitating. It always coexists with the cardinal symptoms and drop attacks, also referred to as otolithic crisis of Tumarkin. Meniere's illness is a chronic illness. Usually it affects one ear, but it can do both. The cause of it is unknown, yet the symptoms appear to be triggered by an accumulation of fluid in the inner ear. Every age can be affected by Meniere's disease. However, it usually affects when a person is between 40 and 60 years old. Women are slightly at a higher risk than men and only affects less than 200,000 cases every year in the U.S. It is unknown what causes Meniere's disease. The symptoms can be brought on by endolymph, an excess fluid in the inner ear. However, the reason behind this fluid accumulation in the inner ear is unknown. Problems affecting the fluid that may cause Meniere's disease include inadequate fluid removal, ear irregularities, or blockages could be the cause of this. Autoimmune conditions, infection with a virus, or even genetics. Meniere's disease most likely has multiple causes because a single cause has not been identified. Due to the vertigo, this can cause you to have more accidents. Many people have to be very careful in what they're doing, not do things alone. Mix that with the unknown, and the disease can cause you to be stressed and worried. In this picture, you can see your inner ear's semicircular canals and otolith organs, also known as the utricle and saccule, are home to fluid and tiny hair-like sensors. When your head is moving, these sensory hair cells assist you in maintaining eye focus on a target. They also aid in maintaining your equilibrium. Symptoms can include constant dizzy spells. You'll feel something is spinning and it stops abruptly. One lady spoke about how it seemed like she was on a carousel going very, very fast and she just couldn't get it to stop. And she was having to hang on to whatever was next to her. Vertigo can strike suddenly. It rarely lasts longer than 24 hours, usually between 20 minutes and 12 hours. Severe vertigo may make you feel sick. This could be a result in balance issues that can lead to accidents. Again, be aware of your surroundings. If you can possibly not be alone for some of these dizzy spells, that will help. Your ears will feel full. Meniere's disease patients frequently experience pressure in their ears. With the buildup of fluid, it's going to make it feel very, very full. We refer to this as oral fullness. Loss of your hearing. In the early stages of Meniere's disease, hearing loss may fluctuate. Hearing loss can become permanent over time and not improve. Ringing in your ear. Tinnitus is the term for ear ringing. The word for the noise that accompanies ringing, buzzing, roaring, whistling, and hissing in your ears is tinnitus. Meniere's illness symptoms can appear and disappear. With time, they may occur less often. Meniere's disease does not have a treatment. Treatments, however, can lessen the symptoms. You can take medication to lessen ear fluid and help with nausea and vertigo. Therapy for vestibular impairments can help with balances. Sounds and voices can be amplified with the use of hearing aids. The symptoms of vertigo may be alleviated by middle ear injections. Severe vertigo may get better with surgery. Next, we're going to discuss some of the complementary therapies. These can include acupuncture, chiropractic, massage, reflexology, yoga, and a few other items. A cervical chiropractor sees a number of Meniere's patients in order to treat their symptoms. Upper cervical chiropractic care has demonstrated enormous promise in improving general health and treating persistent issues such as vertigo attacks. Upper cervical care treats neck misalignments, which are frequently linked in research to the onset of unpleasant health issues like Meniere's disease. Variations in the natural curve of your neck can put several tissues, including the brainstem, at risk. Additionally, they may prevent fluid from draining from the head, which would raise vestibular system pressure. It is highly advised that you collaborate closely with a cervical chiropractor to determine whether the bones in your neck are properly aligned or whether you may benefit from atlas and axis bone adjustments. Some experts say using diuretics to control your fluid accumulation will help, keeping your sodium intake down so that you're not accumulating extra fluid. You may also want to look into taking Lasix, but you'll need to contact your ENT in order to do so. Others say that allergies are linked to it. Your caffeine and alcohol consumption can help with if you decrease it, can help with your headache symptoms. Others have used acupuncture for this. But these are some of your common complementary therapies, and I hope you enjoyed my slideshow today, and I appreciate your time.